All right, I'll go ahead and start the introduction, which is welcome everyone to another brown bag of the Justice Information Resource Network. My name is Susan Howley. I'm the Interim Executive Director at JIRN, and I'm filling in for your normal host, Jason Trask. We are so glad that you could be here for this event. For those of you who were lucky enough to attend JIRN's virtual conference, you saw a teaser by today's two presenters. They were both among the winners of this year's JIRN Yearwood Award. Every year, our organization holds a publication contest for statistical analysis centers to recognize those who do an exceptional job in communicating research through either reports that are focused on policy, reports that are focused on statistics or management of data, and also this year we added a new category for dashboards. Today's winners produced reports that were had a policy focus. Am I right? I have the right category, folks? Or were you the research and statistics?
Today's the statistical and management category.
All right. Well, the topics are so intriguing that my mind immediately went to policy because as someone who's active in the policy sphere, I looked at these reports and thought, ooh, how can I use this kind of data? So today we're going to start with Thomas Strauss. Thomas is the director of the Idaho Statistical Analysis Center, which, unlike many other SACs, is based in the state police, which gives him an access or connection to some groups of data, some forms of data that not everyone has. In this current project, he looked at data from the Idaho Behavioral Risk Factor Surveillance System. And his winning publication and focus was on the prevalence on sexual violence in Idaho, the prevalence and health impacts. So sorry for stumbling through that introduction, Thomas, if you'll forgive me. Go ahead and share your results.
Sure. Thanks for that setup, Susan. I think you did great. Yeah, so for those who were on the conference in the session last Thursday, we're going to do a little bit more of an expanded version of that. So I had to kind of breeze through those results pretty quickly last week. And so we'll dig in a little bit more. But for those who weren't, I'm going to set it up much the same way. First of all, I want to thank the Sexual Violence Prevention Program and the Behavioral Risk Factor Surveillance System team over at the Idaho Department of Health and Welfare. We could not have done this project without them. They brought the idea to us. They gave us most of the data that we needed to do this project. And they helped kind of edit and refine the report along with us as we got that written. And so very, very heavily involved in the project, and SVP funded it as well. So that always helps for them to have kicked a little money our way to be able to do this. So Yearwood Awards are always about, communication of research, right? And so I give you a little bit of the background here. So the format we decided to go with was a research brief with an emphasis on visuals. And the reason for that is that our core audience for this was subgrantees of the Rape Prevention and Education Program, which is a CDC grant that the SVP program manages, as well as other people in the victim service sphere, so victim service agencies and others kind of that do that kind of work, as well as program managers of those programs as well. This was really who we were trying to reach with this report. Of course, we publish this out as far and wide as we can. And so other stakeholders who are interested in sexual violence and their associated health outcomes, we were wanted to make sure that we are able to reach them too, as well as the general public, just anyone who has an interest in this topic. We want to make it as accessible as possible for them to get that information. So we posted the report to our public-facing website in November of 2024. We sent out alerts through our mailing system as well as the Idaho State Police news alert system to try and reach as many people as we could. We always now that's a new thing for us that we were integrated into the agency's mailing list just a year or two ago. And so that's kind of a nice way to reach an even broader audience than we have in the past. And then I was able to give a presentation on this data to the Idaho State Sexual Assault Response Team last December, which is a working group, a state level working group of people from all across the criminal justice system and some adjacent sectors that have an interest in planning responses at the state level to sexual violence. And that generated a lot of good conversation. And the thing that always interests me is what additional research do we still need to do? And so those conversations are still ongoing. We're heavily involved in that, but a lot of that was kind of jump started by this report that we did. So why did we do it? Data on the prevalence of sexual violence, I'm sure, like most other places in the country, here in Idaho is virtually non-existent. The last time the state did a crime victimization survey was in 2012, so more than 10 years ago. And so as of right now, the best available data that we have on sexual violence comes from our state's NIBRS repository and our victim service grant performance data that we have at the state for programs like VOCA and VAWA. Which we know only gets us part of the picture, right? So we wanted to understand kind of how much are we missing by not having that's a broader kind of population survey like a victimization survey. To be able to do that, we were able to leverage the behavioral risk factor surveillance system, thanks in part to the sexual violence prevention program having added questions to our state survey periodically over the years since 2011. For those that don't know, the BRFIS is a large public health survey. It's a CDC program. Every state administers the survey in their state on behalf of the CDC. So we have really good state level survey data on a lot of health related data for the adult population in the state through this program. And so you can see here that 5 years, in 5 years since 2011, the SVP program had gotten additional questions added to Idaho's state survey on people's experience with sexual violence. And in addition to that, our state BRFIS program also collected ACEs data in 2018 and 2020. So we were able to get not just at sexual violence broadly, but we were also able to look at child sexual abuse through those ACEs questions. So really an additional data set that gives us a lot more information than we previously had. And in doing this, in adding these questions to this big kind of population health survey, we were able to connect those experiences of sexual violence or of childhood sexual abuse with other data that survey collects, such as demographics and a wide range of health outcomes. The reason that this project was brought to us is because the State Department of Health and Welfare has limited ability to publish its own research reports right now. They collect a lot of data, but they're not doing a lot of publishing of that data or of research that's done with that data. It's fairly easy still to put in a data request and get that, but they're not publishing a lot of that directly. So what the reason that it was brought, and sorry, the other thing here too is that for the SVP program specifically, like I mentioned, they have a small kind of staff. They have one full-time program manager and one part-time program specialist, and they administer their primary role is to administer this CDC grant that gets subgranted out to various entities around the state. And so they don't really have a lot of capacity just within that team to publish their own research. And the agency as a whole has kind of scaled back the amount of research that it publishes in recent years. And so in talking to them, they felt that we were a good kind of vessel, I guess, for doing some analysis with this data and getting that information out to the people who can actually use it. And so quickly, how did we do this project? So the Burfus staff provided that survey data from the 2020 and 2021 surveys to us. It was basically already analyzed at the point that they gave it to us. So they gave us both estimates in raw numbers and percentages, and they gave us 95% confidence intervals for all of the data points that they sent over to us. So that made our job really easy as far as analysis goes. We weren't the ones kind of messing around in SPSS trying to figure out survey weights and all that stuff. All that was done by the time that the data got to us. They were able also to disaggregate data beyond to a lower level than the state level. So we have 7 public health districts in Idaho. So we were able to get data by public health district as well as at the state level. They gave us 19 demographic indicators and 42 kind of health outcome indicators. And we were able to cross-tabulate all of that by whether people had experienced or had a history of sexual violence or childhood sexual abuse that they reported on the survey. We were also able to determine kind of who had been victims of sexual violence just within their lifetime and who had been victimized within the last 12 months prior to taking the survey, which gave us some very interesting data to compare to our state's crime data. And I'll tell you in a minute what that looked like. The way that I analyzed the data when it got to us is I basically threw it into Tableau Desktop and kind of visualized where those confidence intervals compared against each other. And that was how I tested for statistical significance between different items that we were looking at. It was in doing it this way, it was kind of an easy way to visualize, where those differences are happening, because rather than scrolling through a spreadsheet and trying to pick them out that way, I just found this easier to do. And this may be hard to see on your screen. I apologize if it is. If anyone's interested, I can email you the screenshot. I'm fine with that. But across the top here, you have the data in terms of percentages, and on the left side of that top row is the estimate for I'm not sure actually which specific data point this is, but regardless, that's kind of your point estimate for that data point. And then on the right side, with where the blue and the red lines are, those are our confidence intervals. And so this was a really nice way for me to kind of quickly comb through the data and see, where do we have statistical differences or significant differences, and where do we not have those. So like I said, we had this for both percentages and for raw numbers. And so I looked at them both kind of side by side to get an idea of what we were looking at here. And then finally, like I was mentioning, so for a little bit of context, we pulled out numbers of victims served in our victim service agencies from our kind of federal grants that go towards victim services. We have that performance data. And then we also pulled some NIBRS data just to put a little bit of context around the survey data that we were seeing here. All right, so now for the exciting part. Here's the actual results. First thing we learned was that over 13%, nearly 14% of adult Idahoans have experienced sexual violence at some point during their lifetime. As you can see here on the map, there's a little bit of variation between the 7 public health districts that we have in Idaho, but not there wasn't any one particular region of the state that was statistically different from the state as a whole. And so at the state level, this equates to about 159,000 people in Idaho, or adults that took the survey anyway. And the interesting thing is when you compare that to, oh, sorry, I got the same slide in here twice. When you compare that to the number of people that we see served at victim service agencies or who reported an assault to law enforcement, it just in 2021, so using that past 12 months data from the survey, we estimated that over 13,000 adults had been victims of sexual violence, compared to under 4,200 who were served at victim service agencies and less than 700 um, who showed up in our state's NIBRS data. So there's very, very big differences there. Previously, we have only had those bottom two data points to look at. But we can see sexual violence is far more prevalent in Idaho than either one of those two data points would have suggested to us. Getting into a little bit of the demographics of who's impacted by violence, we found basically four key demographic groups that are disproportionately affected by sexual violence. The first is the age range, those aged between 18 and 34 years old. And see here, over 20% of the people in that age bracket reported experiencing lifetime sexual violence, which is statistically higher than either of the other two age brackets. Also, household survival budget. So if you're not familiar with this, this is a term that the United Way developed. It's part of their ALICE analysis, which, forgive me, I'm blanking on what ALICE stands for, but the idea behind household survival budget is that it's a higher threshold than just the federal poverty level, because it takes into account, what are the expenses that you have to pay for just to be able to survive and not be going without food or safe shelter or transportation or anything like that. So while the federal poverty level is a little bit lower, the household survival budget brings us up even a little bit higher than that. And so what we see is that people who live below that cutoff line for the household survival budget in Idaho experience sexual violence at about double the rate as people who are above that cutoff line. Probably not surprising to anyone, females are far more likely to experience sexual violence than males. In the 2021 data, that was about 22% of the state's female population had experienced sexual violence at some point in their lifetime, compared to only 5% of males. And then those who identify as being LGBTQ were victimized at about 3.5 times the rate of those who would not put themselves in that category. You can see here that rate is approaching 40%, which is just way, way beyond any of these other demographic groups, as well as the state level, kind of broadly speaking. They by far are the most impacted by sexual violence, at least in the data that we were looking at. Shifting gears to child sexual abuse a little bit, we saw a similar number, 13.5% of adult Idahoans had a history of childhood sexual abuse, according to the ACEs data that was collected on the survey. We did see that Public Health District 5, which is the light green down in the south central part of the state. If you're familiar with Idaho, that's where Twin Falls and the Magic Valley is located. They had a rate that was statistically lower than the state as a whole, but they were the only ones. All of the other 6 districts did not differ from the statewide total. The most common type of childhood sexual abuse that was reported was being touched sexually by a parent or other adult. That was about 12% of respondents. Interestingly, if you look down at that bottom number, although it was the least common at 5%, That's still quite a few people who were forced to have sex with a parent or other adult when they were children. And so I think even though that's kind of the least common of the three types of abuse that were measured in the survey, that's still something I think that practitioners should be taking note of. All right, getting into the health impacts. And so we found that people who had experienced sexual violence at some point during their lifetime reported significantly higher rates of 11 different adverse health outcomes compared to those who had never experienced sexual violence. And you can see the range of these conditions on the screen here. They cover both physical health, mental health, substance use or abuse. Um, and even one right in the middle there is cost barriers to medical care, which means that even for someone who has one or more of these conditions, they might have trouble accessing care and getting treatment for those conditions simply because they can't afford it, which is only going to make that problem worse, right? And so really interesting findings here that I think out of those 49 or 42 or 49, go back to my one of my previous slides, you'll see the actual number. That 11 of these were more prevalent among people who had experienced violence than those who hadn't. And then finally, we looked at the rest of the ACEs data as well beyond childhood sexual abuse. And we also found that those who had reported experienced sexual violence at some point during their lifetime also had higher rates of 7 other ACE indicators beyond just the childhood sexual abuse one. So again, you can see here alcohol and drug abuse in the house, having a household member that's incarcerated or struggles with mental illness, parental separation or divorce is fairly high, and then experiencing other types of abuse, emotional and physical abuse, as well as childhood sexual abuse. So now that we've gone all over the numbers, just to kind of cleanly tie this all up together, our big takeaways here were that the survey data that we saw in 2020 and 2021 in our BRFIS surveys for those years put the prevalence of sexual violence in Idaho much higher than we would have expected given our state's crime data or our victim services data. And even when you bring in data from the National Crime Victimization Survey, when you look at what the reporting rates are nationally, in 2021, the reporting rate to law enforcement was 21.5%. Based on the data we have here, that reporting rate in Idaho could potentially be as low as 5%, which is far, far lower than I think anyone, even myself, would have expected before we started looking at these numbers. Secondly, the majority of sexual violence victims in Idaho are not seeking services from our victim service agencies, or at least aren't being served if they are seeking those services. So we thought that was kind of an important thing to pull out. Remember that 13,000 victims within the last 12 months before taking the survey, compared to about 4,200 served that same year. That's a pretty big discrepancy, and I think it's important to kind of dig into that a little bit with our partners, with those out in the field, and figure out, what's going on there. Why are we not seeing all of those people? And that's something that we're continuing to have conversations about in Idaho. Is now that we know this, what do we do about it? And again, going back to the health outcomes, the 13 to 14% of adult Idahoans who have experienced sexual violence at some point during their lifetime disproportionately experience a wide range of adverse health outcomes, including poor physical and mental health, substance use, and those financial barriers to accessing care for those conditions in the first place. And so taken together, we think that all of these findings demonstrate a need for coordinating sexual violence prevention and response strategies that address all of the things that we learned here that minimize the harm from exposure to sexual violence, which we know is a much higher percentage of the population than we previously thought. And knowing all this too, if we can prevent sexual violence from happening in the first place, that will mitigate kind of those later in life health impacts that we're seeing show up in this survey, and should improve both quality of life as well as public health and public safety for everyone around the state. All right. So I know I went through a lot there very quickly. I'm happy to take any questions if we have any. I have not been monitoring the chat. But also you can go read the full report at our website here. You can email me or call me if you think of questions later. I'm always happy to take those. And yeah, with that, I will turn it back over to Susan.
Great. We have time for a couple of questions out of chat right now before we go to the second presentation, and then we'll just stay as long as folks can stay at the end to get all of the questions answered. But let me see how many we can knock off in the first few minutes here. Thomas, you pointed out how much higher the rate of unreported sexual violence was here. Now, typically folks get pushback for what's considered the standard difference between reported and underreported or unreported. Did you get any pushback when you came out with these extraordinary numbers of the extraordinary difference between those who'd experienced sexual violence and those who reported it?
Not in this particular context. I have had that pushback happen in some other contexts when we're talking about just the comparison between the victim services data and our state's NIBRS data or our law enforcement data. There was one particular incident that I'm thinking of that happened a year ago with a county prosecutor that I was meeting with. Luckily, it was a meeting of a multidisciplinary team, so there were representatives from healthcare, from law enforcement, from victim services, from all of the stakeholders that you would want in a meeting like that to kind of push back on that idea and say that, like, no, just because you may not be seeing the same numbers in your agency doesn't mean that we're not seeing something that more closely reflects the data in our agencies. So that was an interesting conversation to have, and it was nice to sort of have that firsthand experience there to back up what I was bringing with the data to that meeting. I wish I had that at every meeting. Unfortunately, I don't. So I kind of have to speak for them sometimes. But yeah, but luckily, at least at the state level, the working group that I mentioned before, when I first brought this report to them back in December, no one questioned it at all, really. I think it kind of struck. Yeah, it struck everyone as believable based on their own experience in their own fields. I think we all kind of knew this stuff. What I think probably surprised people was the magnitude of that difference. It certainly surprised me when I first saw it. And I work with the data all the time, obviously. And so for that to be even surprising to me, I wouldn't be shocked if people from that group told me that was a surprise to them too. But, like I said earlier, it kicked off a lot of good conversations about, like, what does it mean for how we address sexual violence in our state? What do we want to do next? What are some things that we think we really need to focus on, to improve our both our response and our prevention strategies? And so from that perspective, I think it was good to get the stuff out there and kind of open that discussion and provide a context for having that discussion.
That's great. I hope that we can talk about that more at the end of our session today and to get to some of the other great questions that are in chat. But now, in the interest of time, I'd like to bring up Lena Dechert. So Lena is a research scientist at the Wyoming SAC. She has particular expertise in domestic violence and in missing and murdered Indigenous women and people. She is also committed to science communication, which explains why her publication won one of our Yearwood Awards. This publication is Wyoming's, it's the state's Addressing Intimate Partner Homicide in Wyoming, a comprehensive analysis of fatalities from 2014 to 2023. Lena, go ahead and share your research with us.
Thanks, Susan. Let me see. Okay. Hopefully you're looking at a PowerPoint. Okay, so good afternoon to some of you, good morning to the others. I know Thomas and I, it's not quite noon yet, but good morning, good afternoon, wherever you are. My name is Lena Dechert, and I am a research scientist at the Wyoming Survey and Analysis Center. We are a university-based SAC located here at the University of Wyoming, the only four-year college in the state, in Laramie. And I'm honored to be here with you today, and on behalf of my whole team, excited to talk with you about such an important issue. I gave the brief presentation last week on this report at the JIRN conference, but I'm really excited to be here again with you today to get to talk in a little bit more detail with you about this work. So a little bit of backstory. One thing that we really like to do here at the Wyoming SAC is reach out to our partners at the state level and to ask them if there's any issues or ideas in the state about things that should or could be looked into. And our Division of Victim Services had mentioned to us at one point that Wyoming has a formal process for investigating child fatalities, but not for adults. So we decided it would be interesting to kind of take a look at how one of these fatality reviews would work. We decided to focus it in the context of domestic violence, and we just wanted to see what this would look like for Wyoming. So our goal was pretty straightforward. We really just wanted to identify the main risk factors that are contributing to domestic violence homicide in Wyoming with the hope that we might be able to help prevent some of the future deaths. And we decided to take 10 years worth of domestic violence homicide data to do this. Our approach was to take on the role of a domestic violence fatality review board, which has never been done before in the state of Wyoming. 45 states, I believe, have a domestic violence fatality review board. Obviously, Wyoming is not one of them. So this was kind of uncharted territory for us. We work closely with our Division of Victim Services since this was something that they've kind of been wanting to look at for years as well. And the report ended up being pretty lengthy. So we actually ended up organizing the report into 9 different chapters so that the hope was any audience could pick up the report and skip to a standalone chapter and get all of the information that they needed without having to read the whole report. We plan to send it to everyone that will possibly read it. We would love for as many people in the state to see it and outside the state. But every single chapter in the report is structured about the same. They all begin with a chapter overview, and then they have a section of definitions that explains how we, what our scope was really and how we narrowed definitions for the research. And then if relevant, there's a little background or literature review section, and then it moves into methods, findings, and a discussion. So ultimately, we would love to see policy maybe come out of this at some point, but for now, we were just really excited to have been able to do this research for the first time in our state. So I'm not sure if you all are familiar with domestic violence fatality review boards, so I wanted to give a quick definition. I did last week, but I think it's worth going over again. These are boards that are made up of teams of people from all different backgrounds. So we've got like law enforcement, healthcare, service providers, school personnel who all work together to review the circumstances around domestic violence fatalities when they occur. And really, they just try to piece things together and look for any red flags to understand where there might have been gaps. They never place any blame on any individual agency or actor, but work together in a collaborative way to try to understand what might be a good area for improvement and prevention in the future. So most of the time, from what I understand, states will choose 1 or 2 fatalities to review each year. I would assume because of time constraints, and I would guess a lot of these people are volunteering their time on these boards. But because Wyoming is tiny, we don't even have 600,000 people in our state. So we decided we would take a look at every single one of these fatalities that happened in our state between 2014 and 2023. And that is where this study came from. So we tried really hard to get as much data as possible. The project was intended to build the SAC's capacity, and this was a big part of that since the SAC had never pulled from some of these data sources before. So just kind of walking through these really quick, the computerized crime victim compensation system is managed by our Division of Victim Services. They keep track of expenses for burials, and they have a field that indicates whether it was a domestic violence related incident. We did not access their list directly with our own eyes, but we worked with their team to make sure that our list wasn't missing people, and I'll talk about that a little bit more in the next slide. We also worked with our Division of Criminal Investigation and their vendor to match our list of homicide victims and perpetrators to criminal history records in our state. We partnered with the Department of Health through a data sharing agreement to get homicide data for our entire 10-year time period. We used NIBRS with Wyoming Law Enforcement Agency data to look at non-fatal instances of domestic violence in 2024. We worked with the Supreme Court to help look for active protection orders. We needed their help because protection orders in Wyoming, our protection order registry is part of NCIC. So since we're only a university-based SAC, we don't have access to NCIC since it's for law enforcement purposes. And then at the local level, we did public records requests for police reports and coroner's dockets, and then we did a ton of keyword searches online to get data from public access sources like the Wyoming Silent Witness Initiative, newspapers, obituaries, and really just everything we could possibly get our hands on. So next, to identify our cases, we started by, we don't just have a running list of domestic violence fatalities in our state. So we started by requesting a complete list of all the homicide victims in the state between 2014 and 2023. In that 10-year time period, that was 254 individuals. So next, we decided to start narrowing the list. We reviewed our Silent Witness Initiative in Wyoming, the obituaries. We did the keyword searches for things like domestic violence homicide, or killed by husband or boyfriend, killed by wife or girlfriend. And then at this point, we decided we also needed to narrow our criteria a little bit. And we narrowed to just intimate partner homicides instead of all domestic violence, because we were noticing there were some really big differences in the context of domestic violence between like a parent and a child or siblings versus intimate partners. So with that narrow definition, we got down to 42 potential cases. We then cross-checked this list with those compensation records to make sure no one was missed. So Division of Victim Services, like I was saying, they sometimes pay for burial costs for domestic violence homicide. So we just had them take a look at our list, take a look at their list, and make sure that nobody was missing. And then from there, for each case, we identified the lead law enforcement agency and we submitted public records requests to view those police reports. So in total, there were 23 agencies that we contacted, and we received 33 police reports covering 32 incidents. So 7 of the reports and 7 incidents were unavailable because the investigations were still pending, so they couldn't release them to us yet. And then 1 law enforcement agency declined altogether to provide information about 3 homicides that had happened in their jurisdiction. The reason they gave us was they felt that this report was not in the public interest. So we moved on from that. The level of detail varied a lot in these reports. Some of the reports were really short, like 1 or 2 pages. Others were hundreds of pages long. Sometimes they were redacted, sometimes not. We would get redactions where it would just be a child's name. And then we would have some agencies that would send us like 40 pages of just solid black line redacted. So it was kind of a little bit interesting to see what we got from the police reports. But then we also requested coroner dockets from 14 counties where our homicides occurred. We received 30 of the dockets from 8 coroners. 6 of the coroners could not provide the dockets because of the sensitive nature of the cases, which typically meant there was a sexual assault involved. So that was fine. And like the police reports, the level of detail varied a lot. Some reports gave us everything, toxicology, what jewelry the victim was wearing, things like that. And others, it was almost just the name of the victim. So then finally, we reviewed every single report. We reviewed every docket, public information, everything. We built an access database that had all of the victim and offender details, relationships, case circumstances, everything we could think of. And we finally excluded 2 more cases because even though it was an intimate partner who had killed an intimate partner, they didn't happen in these incidents, didn't happen in the context of domestic violence. So that left us with a final count of 40 intimate partner homicides. So to move on to the findings, like I said, total of 40 cases. This is broken out here by sex. We included every single case we could find, but we know this was an undercount. And we know it because there's additional victims whose lives can't be represented in this data set. So for example, somebody who took their own life to escape abuse would be considered a victim of intimate partner homicide, but it would not have fit our criteria because that suicide would not have been recorded as a homicide. So we know people like that are missing. Similarly, with the scope of our study, we weren't really able to look into collateral victims or child victims. So just keep in mind as we go through this, that this list is complete to the best of our ability, but it's probably should be considered more of a sample than a census. So for key trends, on average, 1 man and 3 women are killed by their intimate partners each year in Wyoming. Like I said, 40 cases, so you can see 40 primary victims there. But there was a total of 56 deaths that were reported across these 40 incidents, and that is because 13 of the perpetrators killed themselves after killing the primary victim. And in 3 of those murder-suicides, a child was also killed, which gives us those 3 collateral victims. And then I have a map here really quick. I don't know if people are familiar with Wyoming. I would assume not super familiar, but that little dark box down in the right-hand corner, that's Cheyenne in Laramie County. So there's nothing super surprising about this map. Most of our population is down there in Laramie County. So moving on to demographics, 83% of our victims were female, and the median age for both the male and the female victims was 41. We used the median age instead of the mean to try to reflect the typical age and account for any outliers. And then the most common level of education for the victims was a high school diploma or a GED. Second most common was some college credit without a degree. And the reason we have this information is because it came from the vital records death data. And then we were also able, in some cases, to determine the employment status, and most of the time when we could determine it, the victims were employed. For perpetrators, 83% of the perpetrators were male. So if you're keeping track from the last slide, where 83% of the victims were female, you'll see that every one of these homicides took place between 2 people of the opposite sex. Perpetrators tended to be just a little bit older than the victims. Education, since we got this from vital records for the victims, we don't really have it for the perpetrators because they're not in the vital records. So education level was just largely unavailable. I think we knew for 7 of the 40 perpetrators, so we didn't really want to comment on it much here. And then finally, most of the perpetrators were employed at the time of homicide. You might notice that race is missing from this list, and that is because with only 40 people over 10 years in our sample, if we had included race, it would have been extremely easy to identify who we were talking about. And we didn't really see any reason for that. So we left race out of this part. Power dynamics, this is something that we thought was pretty interesting to look at. Unfortunately, we were only able to identify the employment status of both parties in 21 of the cases, so only about half, which is not great for identifying trends. But you can kind of see some patterns emerging. Both the perpetrator and the victim being employed was the most common dynamic we saw. Second most common being an unemployed victim and an employed perpetrator, maybe indicating that the perpetrator had some financial control over the victim. It's hard to say when half of the sample is missing and we can't talk to the victim about the reason they stayed in the relationship. So interesting stuff, but not really conclusive at all. So moving on to relationship dynamics in these cases, almost all of our cases occurred between current intimate partners. Only 3 were between ex-dating partners or ex-marital partners. So for the current partners, there was kind of an even split here, half married, half dating. And then I gave you some statistics on this screen. At least 41% had said they wanted to leave the relationship. At least 60% had been abused in the past, and at least 30% had told their family and friends that their partner had threatened to kill them before. So it's important to call attention to these all being at least statistics because they're certainly undercounts. These are going entirely off of public information, what we found in police reports, etc., which is a lot of times interviews with family members and stuff. So there was probably a lot more going on behind closed doors that we have no way to know about. So just kind of letting that sink in for a second, how high these percentages are and still knowing that they're conservative estimates. And then we were also able to determine the length of relationship in some of the cases, not all of them. It was most often between 1 and 5 years. This was tough because a lot of these relationships are marked with patterns of on again, off again dating behavior. So it's hard to tell when the relationship really started and when it ended, if it ended. But the best we could do was estimating about 1 to 5 years. Most of the homicides happened inside a home that was shared by the victim and the perpetrator, and it was most often in their shared bedroom. For means of death, this graph is the breakdown by sex. Pretty overwhelmingly shows that the homicides were perpetrated with a firearm. Not probably a surprise anywhere, certainly not a surprise in Wyoming. And for females, the next most common manner of death was blunt force trauma, and for males, stab wounds. So we decided to look a little bit deeper, do a deeper dive into the firearms, and what we found was kind of interesting, but I probably shouldn't say surprising. Among the 23 perpetrators who had used a firearm, at least 48% had a history of substance abuse, 39% with a known mental health issue, 52% with a known history of domestic violence abuse or as a domestic violence abuser, and then 30% had threatened their partner with a weapon before. So again, these are at least. Most often we see that it was a handgun that was used, followed by rifles and shotguns. And then finally here, 22% of the perpetrators who used a firearm to kill their intimate partner were legally prohibited from possessing that weapon at the time of the homicide, which we'll talk about a little bit more with criminal history. But moving on to motive. Again, this is coming totally from police reports, so what the neighbors overheard, what the family members think happened, sometimes what the perpetrator reported. Kind of at the mercy here of what people interpreted the motive to be, but pretty overwhelmingly arguments and perceived infidelity were the leading motives. A lot of cases had more than one motive, which is why these percentages look crazy and they do not add up to 100%. For example, people that were in an argument over perceived infidelity, a lot of times those people also had concerns with paternity status. So you can see how some of these kind of go together and layer on top of each other. So then for criminal history, we worked with our Division of Criminal Investigation and their vendor, Innova Solutions, to get the criminal history records for all 40 victims and all 40 perpetrators, which is why you see the starting case number there at 80 cases. The vendor used Soundex matching to match our list of names, birth dates, date of the incidents, etc. with their records. They came up with 53 potential matches at varying confidence levels between 1, which was an ideal match, and 6, which was not ideal. We decided to keep confidence levels 1 through 4 for the analysis. This brought our list down to 36 individuals. And then you can see we had two individuals that we excluded because of conflicting dates. And specifically, these individuals were victims and they were deceased, but they had an arrest date after the day that they were killed. So we concluded that they were not who we thought they were, and they were removed from the sample, which left us with 34 individuals, 25 were perpetrators, and 9 were victims. So for the perpetrators, there were 25 of them, but only 18 of those 25 had a criminal history before the homicide itself. 7 were only in the data because of the homicide. So among those 18, you can see that these perpetrators had a pretty significant and violent history. 25% arrested for violent crimes, 10% arrested for domestic violence, although you should note that only 2 of those 4 individuals were convicted of domestic violence and 2 were only ever arrested, no conviction. 18% were convicted felons, 30% were prohibited from purchasing or possessing a firearm. So again, of those 12 that you see on this screen, 5 of these individuals who were prohibited actually did use a firearm to commit their homicide. There's a lot less going on with the victim's criminal history. I think we had 9 victims overall that I told you had an arrest. Only 6 had ever been convicted of a crime, which is our 15%. And only 1 of those was for something that was violent. That violent crime was domestic violence. And then interesting to note, we worked with the Supreme Court and they were not able to find one single active protection order at the time of the homicide. So we're not sure why that is, but there were none. Moving on to risk factors, we spent a lot of time looking at the literature, trying to figure out what the most prevalent risk factors are in these cases, and then looked for them in our cases. You can see we found quite a few of them: access to firearms, history of violence in the relationship specifically, and criminal history were 3 that we saw most often in this study. And again, very conservative estimates here on what we could know just from public access data. Victims, we took a look here. To be clear, none of these risk factors are meant in any way to imply that the victims did something wrong or that they deserved what happened to them. But nevertheless, these are factors that increase a victim's risk of becoming a victim of homicide. So we did see history of abuse and expressing a desire to leave pretty prevalently among our victims. Next, the most interesting part of the study, in my opinion, kind of the crown jewel of our report, is these lethality assessments. So if you're not familiar with lethality assessments, they're validated tools that can be used, usually like a questionnaire, and people, whether it's law enforcement, a doctor, a service provider, whoever, can give these questionnaires to victims who they suspect are victims of domestic violence, and based on the scoring of the tool, they should be able to tell if the person is in danger, and if so, what they can do to help. So we chose to use Dr. Jacqueline Campbell's danger assessment. It's very validated, highly respected. It has 20 questions on it. And we took it and applied it retrospectively to our 33 cases with female victims. It's only validated for females. So we then also applied the weighted scoring system and the levels of risk took a look at what those were for our victims before they died. You can see here the 4 categories really range from a fairly low risk to extreme emergency situation. So this is what that looked like. You can see that 70% of our victims were at an increased risk of fatality, and 30% of them were in an emergency situation. So just thinking about that for a moment, still knowing conservative estimates, and we're limited with the public information, these were probably quite a bit higher. So our goal with these was to understand if these assessments would have been able to detect how serious the danger was, and overwhelmingly the answer is yes. So if the victims had been fully aware and honest about their situation, because I think a lot of times domestic violence victims have a hard time seeing that they are victims of a crime. A lot of times they take blame on themselves. So if they were able to be aware of this and honest about their situation, and if someone had screened them with one of these tools, maybe it could have helped. And to be entirely fair, it might have happened, and we have no way to know about if these assessments took place. They're not standardized in our state. And then I just put up here the most common cited risks. This was from the assessment and the questionnaire. These are 6 of the questions. These are the ones that were most common. And interesting is number 1, so history of domestic violence without an arrest. So if you remember from our perpetrator slide, only 4 of our perpetrators out of 40 had ever been arrested for domestic violence in Wyoming, and only 2 had ever been convicted. However, it was like 60% of our victims had reported a history of abuse in their relationship to family members and friends. So it makes sense here. We know that an arrest for domestic violence is actually a protective factor against homicide, so it makes a lot of sense here that number 1 is a history of domestic violence with no arrest. We also took a look at non-fatal intimate partner violence. We thought that'd be interesting. Since our homicide sample ran from 2014 through 2023, we looked at 2024 non-fatal intimate partner violence data in Wyoming. We used the NIVERS data dashboard, and we found that there were more than 1,300 incidents with 1,500 victims. It's because some of the incidents involved multiple people. Most often we saw these manifest as a simple assault, most often between current intimate partners, and 3% violated a protection order. That's not a lot, but it's more than 0% that we had in the homicide sample. So type of weapon, overwhelmingly, the non-fatal violence involves a personal weapon like hands, feet, teeth, things like that. Firearm use is pretty low. Cutting instruments or knives is pretty low. So a lot less with this escalation of violence. But then if you look at this next slide here for injury type, you can see 91%, most of our victims experienced minor injuries, things like bruises and swelling, cuts and scratches. So we think it would have been really helpful if we'd been able to get a hold of medical records for our homicide victims to see what injuries they had sustained in the past, and to try to see if there was a clear pattern of escalation of violence, which we suspect that there probably was. But of course, and for good reason, we do not have access to people's medical records or mental health histories, anything like that. That is all off limits to researchers. But then I think this is my last slide of data here. The victimization rate really shows that dating relationships are where we're seeing most of the intimate partner violence in our state, followed by spousal abuse. Ex-dating relationships are also up there, and quite a bit higher for intimate partner violence compared to intimate partner homicide. And then finally, you can see there really wasn't a whole lot of difference in the average ages. They might be a little bit younger for victims of violence versus victims of homicide. So the key recommendations, I think this is pretty straightforward. There's no surprises. We think Wyoming would greatly benefit from establishing a formal permanent fatality review board, as well as standardizing the use of lethality assessments statewide. I think both of these would provide really good information to the state about areas for improvement and intervention. I think our law enforcement, specifically EMS providers, first responders of any kind who would be able to administer a lethality assessment, I think that they truly really want to help, and this would be a great way to do that. Also listed, maybe promoting protection orders. It's a little strange we didn't see any of those. And then raising awareness about what intimate partner violence can look like could be another great benefit for Wyoming. I think a lot of times people don't believe when they're told, I'm going to kill you, that they're in danger of being killed. So I think awareness would play a good part in that. Future research, we had so many ideas while we were doing the study, but of course we were limited in our scope. These are just a couple ideas. Needs gap analysis, we need to talk to people and find out if things are accessible to them and if services are working, if they're getting them what they need. Impact on children, a ton of these cases were witnessed by children, and I think all of them were biologically related to the victim. and most of them were biologically related to the perpetrator. There's got to be a huge impact. Collateral victims, we've got lots of kids, we have lots of pets. There's so many collateral victims in these cases that we weren't able to do justice studying, but would be really good to look at in the future. And then non-fatal violence, I think listening to survivors and giving them a voice is another great way to further this research and understand where it is that we might be able to intervene in the future. So that is all I have for you. Please feel free to contact me if you have questions about the report. I'd love to talk about it more. But overall, thanks for letting me take up your time.
Well, thank you, Lena. What a fascinating report. I loved all of those different data sets that you combined, loved the recommendations. And one of the things that struck me is the same thing that Thomas said, where all this research is also a conversation starter, right? For what do we do next? What do we look at next? So there are a couple of questions already in chat. The first is, this is from George, does the crime victim compensation system, where you had said you sent the list for comparison to see if you missed anybody, does the victim compensation system include data from the tribes?
So I don't know that it would be flagged specifically as tribal, but yes, it would. If somebody who was a member of the tribe, we work really closely with the Division of Victim Services to do research with the tribes, missing and murdered Indigenous people here in the state. We have a great relationship with the tribes and with the Division of Victim Services. I don't know if they have a field that would specifically flag a tribal affiliation, but yes, if a homicide had, yes.
Yeah. Okay.
Yep, any homicide in the state should, if the person decides they want to file for a compensation claim, it should be included.
Great. You also mentioned the really low level of domestic violence arrests previously that you found. Did the data show whether there were calls for service that didn't result in an arrest? That question's also from George.
So we looked into this a lot because we were super interested to find out, why is this not happening? Is it the case that law enforcement responds and they decide not to make an arrest, whatever the case is? And we tried really, really hard to find this. And I think only one or two of these cases we could dig up. When we reached out to law enforcement to request the police reports, we asked them, can you tell us, is there any prior call for service with these people? And most of the time the answer was no. So we think that the reason that is so low is we think that these crimes are not reported to law enforcement, but it's really hard for us to tell because it's possible when you're talking about, whether it was reported to the city and it was city police that responded or whether it's the sheriff. If you're in central Wyoming, did the Bureau of Indian Affairs get involved? It's really hard to untangle that with jurisdiction. We looked really hard and we were not finding previous calls for service.
Okay. Christine asks, how did you measure or quantify the increasing violence for the danger assessment in looking backwards at these records?
Yeah, so I wish we were able to look further. Like I said, if we had access to medical records, we would have probably been able to do a much better job with this. But our way to measure whether or not the violence had escalated over the past year really came entirely from the police report narrative. So you would see police interviewing, our law enforcement does an excellent job. They did all of these investigations, were very thorough. And you would see these reports and they would talk to as many people as they could, employers, family members, neighbors, everyone. And you would see, well, so-and-so it used to be, they would just come to work really sad and depressed. And then all of a sudden it would escalate. They're coming to work with a broken bone or a black eye and things like that. And unfortunately, that's the only place we were able to get any medical information. But really, it was relying heavily on the narrative that police had. And then also we have the Wyoming Silent Witness Initiative in our state. And I don't want to butcher how I describe them, but they have a website and it gives a voice to victims and their families where they go in and they tell the story so that they're not silent. And that was huge too. We were able to go in and read the families' accounts of what happened and understand from there how the violence had escalated over time.
Thanks. Folks, go ahead and ask any additional questions in chat. But now I have a question for both of you. You both talked about how your great relationship with stakeholders for this kind of data. Thomas talked about the value of having some of those partners in the room when you're sharing the data. Lena, you relied on folks to interpret the data and to get access to the data. What are your partners now doing with the results of this? Have they specifically asked you to go further, or are they taking this information, trying to make change? Do you know anything about how this is being used? I don't know who wants to go first.
Okay. Well, so really heavily with us, we were working specifically with our Division of Victim Services. We have a wonderful relationship with them. And they inspired us to go down this path of mimic a domestic violence fatality review. So I don't know. I would hope maybe in the future that this turns into a conversation of how can we get fatality reviews and lethality assessments to be standard in this state. But we also, when we spoke with our law enforcement officers, we talked with them and explained the purpose of the project and what we were trying to do. And I think people get scared that they're going to get blamed if something happened and we're going to say, well, it's law enforcement's fault, this person's dead, which of course is not at all our intent. And I think once we kind of established that partnership, we told them, we'll send you this report at the end. We would love your feedback. And we did. We gave people, law enforcement and other agencies in our state, an opportunity to look through the report before we ever made it public and ask them for their feedback on things. So we'll see where it goes. We're really hoping maybe in the future, fatality review boards and lethality assessments become standard practice, but we'll see.
Great. Thomas?
Sure. So I really see this in two ways in my work. One is in how program managers and planners at the state level use the data that we produce, not just this particular report, but over the last few years, we've been focused on generating more kind of short reports, research briefs, dashboards, those kinds of things that are really meant to provide quick access to actionable data. And so in that way, we're fulfilling a request that we get all the time, which is, how do I know what I should be doing, basically, is the question. And so we hope that the data that we're producing, we can then give that back to the people who are planning these programs or are working out in the field to help them kind of identify, what are the urgent needs that they need to be addressing? What does the data have to say about that kind of thing?
Great.
And I had one other thing that I was going to say, and now I'm blanking on it.
Well, let's see if it comes back to you while I ask this other question. You talked about having this BRFIS data, and that over the years, additional questions have been added to really get at sexual violence and child sexual abuse. Do you think that same thing has happened in other states, or was Idaho more progressive or more intentional about adding that? I'm wondering if other states can use this database the same way that you did. There's data set.
Yeah, so that's a really good question, and I don't know. So one of the features of the BRFIS is that because it's a CDC program, you have kind of your core set of questions that they mandate that every state asks. But then beyond that, each state can add on to it as they see fit to kind of get at some of the more local priorities that they might be interested in researching. The fact that we got sexual violence questions added for 5 different years over between 2011 and now is really a credit to the 2 program managers that I've previously worked with at the sexual violence prevention program, because they were the ones that really pushed to get those questions on, and we're able to get that done 5 times. So it hasn't been consistent, but we do have a little bit of data now because of their efforts to get those questions added. So yeah, I think I was responding to somebody in the chat that I don't know what the prospect of kind of reinstating those questions moving forward is. The 2021 data is the most recent data that we have on this. And so I would love to see those questions come back. And I would love to see them being asked more regularly, whether it's, every other year or something like that. That would certainly be better than, the sporadic nature of it that it's been up until now. But yeah, I can't speak to whether other states have this or not, because this was specifically an Idaho thing, at least these particular questions.
That's where my mind was going. You both had such great sort of tips, or you were modeling good practices for communicating research in your presentations today and in your reports. Lena, I love the approach of making sure that people know that your data is at least, because it is limited what you can gather from the sources, and just to have some clear way of signaling to the potential users of your data that this is the baseline and it's probably higher.
We tried really hard to be transparent too throughout the report. Every one of the sections, I told you kind of how the breakdown was, but you'll notice as you scroll through the report, it was kind of hard at the end because it seems like every half page you get a box that says limitations, and it explains, this data is limited. We're doing the very best that we can, but we are at the mercy of what is publicly accessible. But it was kind of interesting too how much we were able to find with just publicly accessible data. And imagine if we had more people involved on this fatality review that had access to much greater data sets than we did. I think that this research would only grow.
Well, Christine really appreciates your report. She said that her office has taken over coordination of the New Mexico's IPV fatality review a couple years ago. And so it was really interesting to her. I think that is all the time that we have today. I want to really thank both of you for these excellent presentations. I can hardly wait to share them widely. Folks in the audience, I hope you will do the same. I also want to draw everyone's attention to chat, where not only did Thomas continue to respond to a lot of questions, but there's a link to the special collection in the JIRN library where you can find both of these reports and the reports of other Yearwood Award winners from this year and past years. So with that, I want to close the session and again offer my gratitude and appreciation to both of you. Thank you so much for this great work and your wonderful presentations today.